menopause is like a line in the sand in a woman's
Mm.
life. It's like everything before menopause, everything after menopause, because the hormones of reproduction are our connection to the world. And so when they change, the way we see ourselves in the world changes. And that can feel grossly like disconnection at first and loneliness. And it's not a coincidence that the highest age group for women's suicide is late 40s. So the good news is, as we start to talk about this, Mary, we allow women to feel understood and heard and know, because we're so good at doing stuff that we start to blame ourselves when things aren't done well. Because again, that's what we were taught, that we're that generation.
Welcome to All Things Menopausal. My name is Mary, and I'm a menopause doula. As a doula, we augment the healthcare profession as menopause support practitioners. I created this podcast, All Things Menopausal, to build community for women going through menopause transition and to foster resilience through the stories that connect, educate, and empower. These stories are real, raw, relatable, and they're very much relevant to the physical, mental, emotional, and spiritual whole person that we are. In our midlife transition, we are not alone. Each week, you will hear from courageous, vulnerable, and knowledgeable guests sharing their passion, their journey, and lived experience. These are little clues to finding solutions to our unique situation. The menopause symptoms are personal, but the experience is universal. Today's episode comes to you on a very special day. This is my gift to you, to all women around the world who are looking for a little piece of affirmation from an incredible woman herself who has courageously taken on the responsibility of uncovering some mistruths and misunderstandings surrounding women's hormonal health. It has become her mission to support clients through the midlife transition, and she does it from a place of love, a place of acceptance, a place of curiosity, and certainly a place fueled by a desire to research and learn more, and of course, driven by her own pure authenticity. I am talking today with Dr. Fiona Lovely, a woman's health expert with specialties in functional medicine, functional neurology, and restorative endocrinology. Based in Calgary, Alberta, Canada, Dr. Lovely's practice focus is to find the root cause of disease, reaching all aspects of health and making space for wellness. She has lectured on the topics of women's health, hormone balance, and brain function extensively. And she is the creator and host of the popular long-running podcast, Not Your Mother's Menopause. 1 million+ people around the world, myself included, have downloaded the podcast and are listening in to learn about the physical, mental, and spiritual journey of menopause. Dr. Lovely operates on a principle philosophy that health is not just about the treatment, it's about empowerment, the ability to claim agency. And how do we do that? By being empowered by current and relevant knowledge and credible information, which is perhaps why in this episode, Dr. Fiona Lovely and I touch on many great pieces of literature on the topic of hormones and women's health. There was so much to unpack, too much in the time we had together. So it'll be my mission to bring Dr. Fiona Lovely back as a regular featured guest. She has so much great knowledge to share, so let's get right to it. I am here with the amazing Dr. Fiona Lovely, and I'm allowed to say that because I've been listening to your podcast for a very long time, and I'm in your brain health workshop, and I'm on your Facebook group, and I find you amazing.
Thank you. That's kind.
Oh,
Glad to be here. Thank you.
The story is that when I was on my menopause doula training through doula training center based in Toronto, one of our assignments was to search the web to understand some of the resources that are out there today for menopause health for women. And the whole purpose of it was to demonstrate to us that there was a real lack or a real bias or a real misogynistic kind of tone to some of the resources. But being a podcast junkie that I am, I said, no, I'm turning to the podcast world to see what's out there because I want to know what I'm going to listen to.
when I would get more educated on menopause. And of course, yours came up top of the list. And what was even better is one, you're Canadian, woo woo, and two,
As
you're
Canadian girls,
hilarious.
we got to stick. Oh, thank you. We got to stick together as Canadian girls, don't we?
Gotta stay absolutely. But and then very funny, but packed with so much knowledge. Like I want to pull over on the side of the highway and take notes when I listen to your episodes because like, oh, that's so good. Oh, I wish I had a pen. So I leave voice memos to myself all the time. Hey Siri, open up voice memo. I have another message from Dr. Lovely's podcast. That's so good.
That's great.
So when I got back into the podcasting world to promote what I do as a doula and just the whole positive conversations around menopause, I'm like, I'm just going to throw it out there into the ether and see if it sticks. Will Dr. Lovely come on my show?
Of course. Of course I'll be here. Thank you. It's a great pleasure to be asked.
Yeah. So always like to know the person's journey, the backstory, the authentic self. How did Dr. Fiona Lovely arrive at where she is today, both in the podcasting world, but more importantly, in functional medicine?
Ooh. Well, the women pulled me in.
Nice.
The women pulled me in. My professional training is as a chiropractor. So that will surprise some people when they're listening to this. But when I was taking my education, my professional education, I was interested in women's health. And so I took as much additional training as I could at the time on the subject of women's health, because I grew up in the era watching Christiane Northrup on Oprah, right? Yeah. Dr. Northrup on Oprah. So that's really where I got my education about what it meant to have a woman's body. Right. And so I kind of came into the world professionally wanting to know not just the GYN stuff, but the spiritual connection between our body and our brain and what it means to be a woman. So I took this additional training because I had been gaslit by a GYN when I was in my 20s.
Oh gosh, yeah.
And I knew what she told me wasn't true. It wasn't true for my body. And yet there was nothing I could do except just trust her. And this was before I was a professional myself. And so I think that sort of set the stage. And then I took all this additional training because I was interested in it. It wasn't even called functional medicine there. And that's how long ago it was. So
wow.
We called it restorative endocrinology. And so again, I took this thinking I was going to use it for myself. I figured I'm going to be a spine expert and carry on. And please understand, as a chiropractor, my education is as robust as a medical doctor's education. Okay. It's just, we get a little bit different. We get more radiology. They obviously get pharmacology, right? So we don't get that so much. So it's the same with naturopaths. Naturopaths have a very robust education, just like chiropractors do. And, generally speaking, we're not thought of as whole body experts, but in fact, we are. We have to be. It's part of our education. So anyways, when I was in about my second month of practice, I was treating a woman who was in her early 40s. And I remember her so well. And she was desperate for help around the symptoms of perimenopause. Mm-hmm. And I had 3 patients in a lot of time. I'm guessing, I don't know how many it was, like 3 patients a lot, because I just graduated, right? So I shared with her everything that I knew. I started to share, and she literally wept. She was so grateful for the information. Fantastic. And of course, at the time, I was about 32, I think, when I graduated from professional school. And I didn't really know yet what it meant to be hormonal in midlife. I didn't know yet. And she just kept asking me, she kept pulling it out of me. She's like, share this with me, share this with me. And this was one of my very first experiences as a new doctor. And thankfully I had a friend who had taken the classes as well before me, and she was already practicing this way. And so she helped guide me. She said, this is what they want, you got to do the testing this way and that sort of thing. So like almost right from day one, I was not only a spine health doc, so you could come and see me for that work. Right. You still can. Or you can come and talk functional medicine with me. Now we've developed the discipline of functional medicine, and so much in the time since then, 20 years since I graduated. And we have practices that are well established at this point. But back then it was kind of the Wild West. It was sort of like, well, you just got to do what your ladies need. And as a chiropractor, I'm taught root medicine, root cause medicine, meaning I'm looking for the cause of someone's pain, dysfunction, etc. And so it's easy for me because I've always had the mindset to go in, okay, a woman is having hot flashes. So what is the cause of the hot flashes? Is it the egress of estrogen? Is it a thyroid issue? Or is there something else going on? So that's always my mindset. So anyways, this particular patient literally pulled me in and there was no looking back. And I realized pretty fast that this was hot information. Women in their 40s and 50s desperately wanted guidance. This was in sort of late 2006, 2007, desperately wanted information. So I started doing public talks like right away.
Good for
And
you.
well, thank you. And they were called Not Your Mother's Menopause.
I love it. Makes so much sense. True.
So that's how it is that the podcast and eventually the book, which is being written, will be called that, because that's sort of the name that people have associated with me. And, that naming it that I was raised by a very proper British mummy. And you did not talk about impolite things like menstrual cycles or women, don't poop. We don't make uncomfortable sounds or smells. Our bodies don't hurt. And we certainly do not talk about it.
Absolutely. Gosh, that was a generation.
Yeah, it's true. So that's how I ended up doing this work. And here we are 20 years later. Sometimes it's hard for me to believe it.
Oh, blessed be the Dr. Lovelies of the world. Honestly, everyone needs to listen to your podcast and then read your book and be a part of your world, because I feel so much relief. Like there's no gaslighting. There's no misogynistic statements. And just last night I was teaching a yoga class and we got on the subject of menopause, and this participant of mine didn't know that I also have the podcast, and we got on the subject. And I don't know, people just start talking about menopause stuff with me all the time. I must have a big sign and I don't know, but they just naturally want to talk to me. And she brought this up, the fact that, I'm 46 and some of the statements she was making were really odd. And I thought, this is a woman who's been listening to either a mother who has no information, never gave her any proper information, or a doctor that is gaslighting her. And sure enough, she said, my doctor said, I'm too young for menopause. I'm like, well, sorry, sweetheart, you're probably in the throes of it, particularly if you're experiencing the hot flashes. Tells me you've already been down this journey for a few years and you don't even know it.
Yeah. Yeah.
And that's the whole issue. Is so many women are saying, well, is it the flu? Or maybe I ate something, or is it this, or is it that? And we can't figure it out. And then along comes someone with your genius mind and maps it all together and delivers it to us in bite-sized, digestible chunks that make sense.
Yes. Thank you.
I try with your humor.
Well, listen, humor is important, especially at menopause. Oh my God, if we weren't laughing, we'd be crying. But this is what I always try to do with the episodes when I sit down with the content. I always want to make it, first, I'm a super science geek, so I love to look at the research. I love to review the literature. And I love to make it approachable. So yeah, I'm going to tell you what the science says, and then I'm going to translate that for you. And then I'm going to give you, I always end with a toolkit. Like, what can you do right now to help yourself with this particular thing? So thank you for saying that that's what's coming across. Because, when you're behind the mic, you can't, it's not a communication, right? It's just like, hey, this is what I got for you today. What do you think?
Yeah, for sure. I could list off a number of things that you've said over your 100+ episodes. And congratulations when you got to that 100 episode mark. And I listened to that one, and it was a nice compilation of everything that you had experienced and that people had interviewed, and a beautiful summary. That one actually stuck in my mind because you were very forthright and said, we now know hormone replacement therapy benefits are outweighing the risks, and it's completely safe. And this is why you should really be considering this for your health. And that's what kind of set off a trigger for me, which led to listening to more and more. And then you got into the brain health and promoted your workshop. You had the webinar. And I said, if I'm going to enhance my knowledge as a doula and be really there to hold space for clients and give them access to information that's out there, I need to know what is out there. And it was the brain health that you deliver as one of your specialties that really drew me in even further, and your connections with dementia and Alzheimer's. So I was hoping you could speak to that today in our episode, and that link, dementiagens, for example.
Yeah.
And
isn't that a big one?
Okay. Take it away, Dr. Fiona Lovely. Because this one just blew my mind. No pun intended, but it did.
Yeah. So what Mary's talking about is I have a course that's called the Brain Health Master Course for Women. And I release it for enrollees once a year. And I take in a group of women and we go through the material together. And it was born out of my own experience having a mother with dementia, a grandmother with Alzheimer's, and a great aunt with Alzheimer's, and starting to see my own brain function decline around the stress of the pandemic year.
Okay.
So I have a clinical neuroscience degree as well. And I took what I knew. Yeah. I mean, might as well throw that in the mix.
Wow.
My husband's like, seriously, stop taking classes. I'd like to travel someday. I'm like, okay, fine. Like I said, I'm a nerd. I love science. So cool.
You're my kindred spirit, I swear.
Oh, okay. I love it. Good. So during that pandemic year, my father had passed away, with a sudden quick illness just the year before the pandemic. And he was my mother's caregiver. And so that transitioned to my brother and I, and it was all during the time of the pandemic. It was a mess. It was just a mess. And so we were all very stressed. And here I am, like all of us in this perimenopausal era, hormonal fluctuations. I'm not sleeping well at night. I have no idea what's happening with my business because we'd been shut down. And when I go back to my work, am I going to have people to care for it? And, more than anything, I just this is what I do. I connect with people and I offer help, whatever that looks like. And I couldn't do it. It was heartbreaking. I had someone tell me this week that they loved the beginning part of the pandemic because everything got really quiet and they were able to do a bunch of stuff. I was so shocked for so long. I was in this state of shock. And I think I'm still, from a nervous system regulation point of view, still getting that calmed down all these years later. But that's beside the point. I know there's a lot of women like that. So if you feel like you're in a state of constantly being hyper vigilant, that's a stress response to what's happened to us. And it's okay to acknowledge it and say, okay, how do I get help for that? And as you know, Mary, we start the classes, the live portion of the Brain Health Master Course, we start it with nervous system regulation. Yes. Because being able to calm yourself is a huge part of being able to, as I try to figure out what I'm going to say, I see the note I have written at the bottom of my screen that says, health happens at the speed of safety. Right? I know. So how do you get safety? Well, listen, when you're hypervigilant, you're not feeling safe. So you have to put your body physically into the state of calm. And when you do, then you can access higher levels of health, wealth, connection, whatever it happens to be. Okay. So that's what we're doing essentially with that. So you're talking about the Brain Health Master Course, and there's 8 pieces. I call it the Brain Health Matrix, and there's eight pieces. And what I figured out during this very stressful year was, I remember it was July of 2020 and we'd been back to work by about a month. And I remember thinking, the things I use for my work, which is my brain, I can't reach what I'm looking for. I know it's there, but I can't get it. Yeah. What's that word I'm reaching for? I know what I'm thinking of, but I can't, if that joke about if I stick my tongue out, can you read it on my tongue? You just can't get it out. Right. So it scared me, especially watching my mother's decline and knowing the family history. And at that point, I knew I had the genetics that put me at an increased risk for Alzheimer's. And I had taken the training from Dr. Dale Bredesen, which is the End of Alzheimer's program. Oh, so good, by the way. Bredesen is his name. He's got 3 books out on the subject. Please read them. Dale Bredesen, Dr. Dale Bredesen. And I had taken that training and I thought, you know what? I know how to do this. Like, I do it for other people. So it's time to do it for yourself. Yeah. So I put myself together the information because I wanted my brain to work. And the first piece I put in place really was the intermittent fasting piece of it. And I remember it's such a good, for a lot of reasons, right? There's just it's the ketones and then the cleaning up the system and the autophagy. I mean, there's just so many reasons for it to be that it makes sense. And I remember it was like in July, so it was hot outside, and I came home from work. And what do you do when you come home from work? You eat your supper, right? Mm-hmm. But it was my first day fasting. And I thought, I said to my husband, I said, I can't stay on this floor. Like, I have to go upstairs where the bedrooms are. I have to get out of the food zone. And then it was like 6:30. And I'm like, well, what am I going to do now? It was so weird. It was such a strange experience. I remember going, okay, just go lay on your bed and read a book. Like, you'll be fine. You'll be fine. But I remember having to calm myself because I was like, you're going to die. You're not eating. Like, we were so tangled in that food thing. Right.
Right.
Anyways, long story short, the intermittent fasting is absolutely the keystone for me personally. It'll be something different for other people, but it's a huge piece. And when I start to feel myself getting foggy, that's the first thing I go to. It's even less so about what I eat, but the timing of when I eat.
Yeah.
Now the dementogens you mentioned are specific toxins that have a history of causing dementia. And it's things like heavy metals, and it's things like fungicide, pesticides, the things you think they would be, the toxic stuff, the phthalates, the BPA, that kind of thing. They're called dementogens, meaning they will cause dementia if they're present in a high enough amount.
You know, after you aired that in our module, and then you talked about it again, and I had to catch some replays, unfortunately, because my corporate job keeps getting in the
darn it. That's the patriarchy. They're always in there, aren't they?
Oh, that is an entire new episode, right?
Yes,
there.
It is.
But, and after you talked about the toxins, I went through the entire house. Of course, we have mold issues being on Vancouver Island and the dampness, and we got some really crappy windows I want to replace. And my husband's like, well, the budget. Mm-hmm. But we do get that black mold starting to build up. Mm-hmm. And so that's one issue. But I went around the house looking at all the candles, the ingredients.
Oh, yeah.
If it's not soy or beeswax, boom, it's gone.
Yep.
And I'd heard this like years ago probably, but it didn't stick. And then when you mentioned it again in relation to the toxins and the brain health and in the whole construct of menopause, it sent off alarm bells. I paid attention. And we don't think about these things, but it's everywhere in our environment.
Yeah, it's absolutely pervasive.
So what can we do apart from just a little bit of a check and balance, checking and reading ingredients and products? Labels. What more can we do to protect our brain health?
Well, and I think being aware of the toxic load is really, really important. And I like the Environmental Working Group app, which is called Healthy Living.
Okay.
You can scan barcodes and it'll tell you what ingredients are in there. It's definitely US focused for products. So some of our Canadian products don't show up there, but lots do. So that's a good thing, because looking at toxic load is really important. Looking at our inflammation load is also really important. And as you know, as a student of the Brain Health Master Course, you know that this is something I talk about a lot. Even the people who listen to the Not Your Mother's Menopause podcast are getting the message about inflammation a lot. I mean, I just recorded the 113th episode, so it hasn't been released yet. I think 110 will be next up. By the way, the universe speaks. 2 nights ago, I recorded my next episode, which is just me talking about peri and perimenopause. And I went to listen to it to do the production on it. And somehow it recorded me in like twice speed. And I was like, I can't figure out if this is like a message from the universe that there's more information I need to say. So I should re-record it. Or if I should just let it go up. I think most people probably listen to it on fast forward anyway. I will re-record it. I will. I've got too much Virgo in my chart. I will re-record it. It's got to be close to perfection.
Oh, there's no doing it messy with you. Right?
Oh, well, I try. Believe me, there was a lot of work I had to do to get to that place, right? Because we come from that generation, that perfectionism thing, that good girl thing, and which is actually a trauma response. Perfectionism and productivity are a trauma response. I know.
Interesting.
Uh-huh.
Okay.
Yeah. So
wow, I'm in more trauma than I thought I was.
Yeah. I think though in our generation, it's really coming up to be healed.
I'm glad you said that, because Ayurveda practitioners, and I have said this time and again in my, it's like hit repeat on every episode, but Ayurveda recognizes.
Yeah.
I'm running out of material. Quick, repeat.
No, it's just, there's so much, like, you got to talk about stress every episode. You have to.
Yeah.
Right? Because we're so baked into it. Sorry, go on.
No, it's so true. I digress. Where was I? Yes, menopause brain. Okay, click.
Yeah.
Ayurveda, the age of wisdom, but it's also recognized as the time of the great reveal. That any trauma, I know. I'll send you that report, actually.
Yes, please.
The time of the great reveal. So anything that has not been dealt with, physical, mental, emotional, spiritual, will come up in the perimenopause to menopause. When the hormone changes, it's like, hello, remember me?
Yes.
A ghost hiding in the closet. Bam.
Yes.
And that is definitely my experience. So much so that, and my husband, okay, I'm going to reveal something in this episode that I don't really talk about, but I need to if I'm going to be authentic. My husband, he has PTSD, and he's okay about me making a public announcement about it. Too late, I just did. And he, working with his therapist, said to me, you might want to talk to Veterans Affairs, because I think that there's something going on with you too. And I come from a military background, 20 plus years in the service, and experienced things. And so I did. And I got my diagnosis a year ago, just under a year ago, with PTSD. So now I'm in perimenopause, the throes of perimenopause. Discover I have PTSD. Discover that there's a lot of trauma coming up as a result of the menopause, but coupled with the PTSD. And then, and another thing that I want to talk to you about is traumatic brain injury. And you made mention in one of your modules, when you're in the progesterone phase of our cycle, the impact of a brain injury can be far more impactful, more severe. Correct. And then I'm going, oh my God, there's another check in the box.
Yeah.
So I've got all this stuff coming up that I have to deal with now with this trauma. And then again, and as you just mentioned, to sort of bring it full circle, is that we come from us Gen X women come from a society and upbringing that wanted to know, why aren't you perfect? Like, I would come home, Mom, I got 93% on my algebra exam. Well, what happened to the other 7%?
Yeah. That is a common thing I hear. So it's like a lot of threads I want to pick up there. Okay. So first of all, super brave of you to go and have the diagnosis and get the help, because we know that our veterans are some of the best covered in terms of, we know that this is a population that has issues here. And at the same time, there's a lot of gaps in care. And this is especially true in the United States, where a lot of the research comes out of the VA.
Right.
And my father-in-law was an officer in Vietnam and had trauma. So we talk about it in our family quite a bit, as my husband's from Colorado. And anyways, so many things to pick up. The first thing I want to say, congrats. Fantastic. That's so good. I'm so glad you're so well supported, because it makes a difference. And in terms of the things that come up to be healed, there's something about menopause is like a line in the sand in a woman's life. It's like everything before menopause, everything after menopause, because the hormones of reproduction are our connection to the world. And so when they change, the way we see ourselves in the world changes. And that can feel grossly like disconnection at first and loneliness. And it's not a coincidence that the highest age group for women's suicide is late 40s. So the good news is, as we start to talk about this, Mary, we allow women to feel understood and heard and know, because we're so good at doing stuff that we start to blame ourselves when things aren't done well. Because again, that's what we were taught. We're that generation. We were taught that. So connection, hormones, we have this line in the sand. We have to look back at our lives and say, I shouldn't say we have to. We get the opportunity, we get the privilege of being able to look back and say, that, and that I love, I'm so proud of. I'm going to keep doing that. And those 20 other things can FO. Like, that's it, we're done. So there's a reckoning of menopause. And we have the perimenopausal era to figure it out. We have the rest of our lives to figure it out. So it's not like it has a timeline. But we're so good at being productive that we don't step back enough from the productivity to look and say, what the hell's happening? And who am I going to be? So there's one thing I want to say. It keeps niggling at the edge of my mind. So I've got to say it, then I can move on to what else I want to talk about here. But the trauma thing is so important that it's the first thing I teach in my menopause doula program. Yeah, it's a quote from Dr. Northrup herself, who says, midlife throws you up against the doors of everything you haven't dealt with.
Getting chills.
Ooh,
on that
me too.
Statement. So true. Yeah,
Right?
Sometimes I feel like my 7-year-old self is coming back screaming at me with a
Oh,
little tough little 70s pants on, saying, you didn't do this. And I'm standing there going, I'm so sorry.
I'm so sorry. I was forced to wear polyester bell bottoms. What did you expect?
It's scratchy wool sweaters.
Oh, the worst. But here's what you do with that. If you feel her coming in, then when you take a moment to be quiet with her and just see her and embrace her, I know I'll cry too. So embrace her and tell her you love her and you're never going to leave her again. God. Doing this exercise will break your heart into a million pieces. And there's stuff that's so much better on the other side. I know, because I've done it. And I continue to do it because I was that kid that didn't feel heard. I was never enough, right? Whether it was smart enough, thin enough, pretty enough, good enough at school, all of the things that we thought we were supposed to be, right? And I carry that. I'm 50 and it's still with me.
Seriously, I know. And then we imprinted that which was being projected onto us, onto our friends at school. Yeah. I talk about mean girls in high school.
Oh my God.
Talk to my daughter and say, honey, you don't have it as bad as we did. Well, maybe you do, but it was.
Doesn't that every generation say that? I think so.
Pretty much. I had to walk 10 miles to school uphill each way. Yeah. Okay, Dad.
In a snowstorm. Exactly.
Snowstorm. Yeah.
Yeah.
Oh, he was born and raised in Calgary. So I believe him when he says snowstorm. Oh my goodness. Okay. I think we need to take a pause from our sponsor, which will be Kleenex today, because seriously, that is.
I tell you what our sponsor needs to be today is some cannabis gummies, I think.
Oh,
this is Canada after all.
This is Canada. You know what? That would be the next big research paper, is menopause and cannabis. And I remember my doula instructor mentioned that in our doula training. She says there's not enough research on marijuana and menopause because marijuana has not been legal that long in Canada for us to actually legally do a study.
Yes. And there is some research that's available. A lot of it's
good.
come out of Israel, actually, because Israel's been looking deeply at cannabis and endocannabinoid systems since the 70s.
Okay.
Yeah. But you want the big thing coming from menopause? Psychedelics.
Yes. Yes.
Huge.
Even in trauma,
Oh yeah.
trauma therapy, it's
Yes.
coming out psychedelics.
Yeah.
Interesting, eh?
Yeah. Yep. Psilocybin in particular. In
Okay.
particular. Yeah.
Okay. Oh, so much. There's so
Yeah.
many gems. I gotta bring him
Yeah.
back at the regular, honestly.
That'd be fun.
Oh,
Don't
I
threaten. I
have,
might say yes.
yeah, yes. I have so many questions, but selfishly, I want to focus on what's important to me. It's because for me, it's
Go
been
for it.
brain health, and that you see my little Facebook comments, like, "Oh my God, I'm losing my mind," all the time when you do your lives on Facebook, and I'll
Mhm.
throw in a comment, and it normally relates to being absolutely absent-minded. I just the other day at work, I wrote a report before I went on a little quick little holiday just to prepare myself for a big event that I got to put on in January. Came back this week. I said, I got to write a report for this big event that I'm going to be putting on January. And I started and I saved it in a folder, and only to realize that I had the folder already created in my inbox, and open up the folder and there was the damn report. And I don't remember writing it.
Yeah. Yeah. Yeah.
What is happening to me?
So egress of estrogen not only decreases serotonin and dopamine, so now we're talking mood elevation is a problem, but we don't get the same reward pleasure situation.
Yeah.
Estrogen receptors and action are almost brain wide. So as a woman goes through the neurological transition of menopause, so if the physical transition is, there's a lot of disagreement on this, but 10 years, let's say 10 years, let's say perimenopause is 10 years. The neurological transition of menopause is more like 20 years. And in that time, the brain totally reshapes and rewires itself. So what's happening for you and I right now, sister, is that we're stuck in the middle going, what was I talking about? Can I stick my tongue out so you can see it? Oh, I already wrote the report, right? So the thing is, we can't, and estrogen has a very profound effect on the hippocampus in particular, which is the part of the brain that stores memories.
Yeah.
One of a few, but kind of the big guy. And so very much a change there. So if you're still cycling, you may notice a difference in your estrogen phase versus your progesterone phase, which you talked about earlier in regards to TBI or concussion. Estrogen's protective. It's neuroprotective. That's why the beautiful new research from Lisa Mosconi out of Cornell University shows that women who take estrogen replacement therapy have a 36% decrease in Alzheimer's risk.
That's huge numbers.
30, exactly.
36.
Yeah.
Wow.
And estrogen hormone replacement therapy for cardiac protection is a 50% decreased risk for cardiovascular disease.
Big
I know.
numbers.
Listen, as a chiropractor, I was kind of taught we do things the natural way. We don't have to take a pill. So did I ever think in a million years I'd be talking about HRT like this? No way. But now, as a woman in perimenopause with a significant family history of not only cardiovascular disease, but neurodegeneration like dementia, Parkinson's, and Alzheimer's, I'll take everything I can get to keep me out of that, right?
Yeah.
I won't be one of those women that struggle with osteoporosis. I'm fortunate enough to carry extra weight, which means I do weight bearing exercise all day long as I walk around.
I guess.
But that's the other big one that happens to us. So it's
True.
our heart disease, our brain disease, and our bones start to break down.
Yes.
Okay. So those are the risks. And those are the things that tend to have the best. Hormone replacement therapy has great protection for those three things. And we're really just starting to see the research now because it's women driven and we are asking for it. And we've been left out of research for decades for the most part. Yeah. So that's what we're starting to see. We're starting to understand that we can use these things in a specific way. I want to talk about this because I think it's really, really important. You know, women, our mothers were pulled off their hormones because a study that was done in early 2000s said increase women get breast cancer and strokes from taking HRT.
Terrible thing that could ever happen. Yeah.
Exactly. So pulled off the hormones. Now I asked my mom the other day just to see if she could remember why she came off the hormones. she doesn't have any recollection, but again, dementia, right? So that part of her brain is no longer accessible.
Yeah.
But what I remember, because I was in my 20s, late 20s, I guess it would have been, I remember her taking them for a while, but I have no idea why she was taken off them. But to me, when I learn what I learn, knowing that hysterectomies are the second most performed surgery in the United States, it'll be similar in Canada, that there are women leaving without their reproductive parts and not being given hormones, to me, that is a problem, like a really big problem. That's malpractice. Can I say that?
Could not agree more, particularly, and again, you shed some light on this too, and I'd heard it in another source saying, and maybe it was even in the book, and we're going to talk about that in a second, that when a doctor says, oh, don't worry, you still have your uterus, so or you still have your ovary, sorry. Yeah, because I take the uterus. You still have your ovary, so you won't go into menopause. You know, one of those important products down there.
Yep.
That you won't go into menopause. But the uterus is what, 90%, is it?
Yep, 90%. When the uterus is taken, 90% of the blood supply to the ovaries is taken. So there's instantaneous ovarian atrophy. And at the same time that we switch from ovarian hormones, which this happens in perimenopause, we switch over to the adrenal glands making progesterone for us. But they will only do that if they're in the absence of stress, simply because the mother hormone that makes stress, hormone cortisol, and makes progesterone, can either do one or the other. So if we're going in, do you know anybody that's not stressed? I don't know anybody that's not stressed, right? They're kidding themselves if they think they're not, I suppose. Or maybe we're learning enough that there's enough of us that are getting educated and learning to calm ourselves. Remember, health happens at the speed of safety, right? We know this, so we get this coming. But anyways, talk about 10,000 balls up in the air right now. Back to ovarian function. This is what's being sold to women, is that they're said, you're gonna retain your ovaries, so you won't be in menopause. But they come out of the surgery, out of the anesthetic, and with a hot flash, or with low mood that's not dissimilar to what happens postpartum, that huge decline in hormones. And this is true for most women that have hysterectomy. Some don't have any problems at all. And we do know that there are women out there that do not get any symptoms of menopause or perimenopause, but by far, most of us would benefit from. I know was it last year? Yes, I talked to Dr. Luann Brizendine, who, if you haven't read her book called The Upgrade, please read it right now.
Okay.
It is like the brain health menopause connection. It's excellent. Dr. Mosconi has a new book coming out in February called The Menopause Brain too. So that'll be a great one to read. And her research is amazing. But anyways, Dr. Brizendine said that when she had her hysterectomy because of, I think it was fibroids, if I remember correctly, don't quote me on that, but it is in the episode that you'll be able to listen to. She asked to have the patch put on her, the estrogen patch put on her before she was even rolled out of the operating room. But she had to ask for it.
Yeah.
Right. Yeah. So if you're
Advocate.
yeah, absolutely. Mm-hmm. This is the thing about education. This is why the podcast is such a popular thing, is because women want to be educated, but we don't know who to trust. We don't know where to go for information. And, for me, I'm not in the medical system. I was never trained in the medical system, but I can see it as an outsider. And I can see how mismanaged women's health has been. And I'm not saddled with the primary tool of prescription.
Yes.
Or drugs, right? So I can see the things that need to be done. That's not just, here's my only tool for you. Here's an antidepressant for hot flashes. Now go have some acupuncture and have a bath. Yes. Right? Can you imagine a man being told that when he went in and said, my penis doesn't get hard anymore? Right? So we don't live in an equal system, and the doctors are not bad people. They started in this profession like me because they wanted to help people like you as a menopause doula. but it's about the system they were taught in. It's changing, but you have to understand there is big money and big policy involved. So it's a big ship to turn around. It's like a 747 wanting to turn around on a 2-lane highway, right?
Yes.
It's possible, but it takes time and a lot of like, over here, pay attention over here kind of thing.
Yeah.
So, I think it's important to look at it that way. But because I was never in that prescribing opportunity, I can see it from the outside and look at the science and say, that doesn't make sense, but this does. So let's talk about this over here, right? And so being an advocate for women, giving women the information to educate themselves so that they can be better advocates, not just for ourselves, but we advocate for our families and for our communities and for others in our society that may not have the privilege that we do. I mean, you and I are two educated Caucasian women sitting in nice, warm homes, having this conversation over the internet, right? So we recognize the privilege in that, and we say, okay, how do we make our community better? How do we take the information we have and help those that maybe do not have the same privilege? I think that's an important part of the discussion.
So important. You mentioned some great books, and another one too that is starting to really unpack some of the lies that the big pharma have been telling us. You've mentioned it in your podcast. I immediately went out and got the book, and that is Estrogen Matters. This is the Bible for women, honestly.
Ding! It needs to have a sound effect when it shows up on the screen. Estrogen Matters is the book that Mary's talking about, and it's by Doctors Avram Blooming and Carol Tavris.
It's wonderful. I'm going to get that in the show notes with all the great details, and I love that every woman should not only own that book, but should buy it for her GP.
Yes.
And say, here is a gift for you. Go out and get some education. But
yeah, and I think what's important to know about how that book was written was Dr. Blooming's wife was being treated for breast cancer, and he's a medical oncologist and a hematologist, if I remember correctly. And so he's a blood cancer expert or blood expert. And his wife was having terrible menopausal symptoms because of the treatments for the breast cancer, and he wanted to give her relief and couldn't find any really good information on how to help a woman who's having menopausal symptoms that's also going through the experience of breast cancer. And so he went about reading the research himself. He thought, well, I can do this. And so he compiled the research to figure out whether or not he could prescribe his wife whatever she needed.
Exactly.
And so it's really written from a point of how can I be maximally helpful in a time where women need us? And I think that sort of mindset gets lost a little bit in the busyness. And this is certainly true of our healthcare system here in Canada, as our GPs are just so busy and so overwhelmed. I'm sure, I can't even imagine. Well, I do know, because I've got friends that are GPs that tell me about what practice has been like since the pandemic, and you can't give anybody a hard time about it. I mean, sometimes people are just a jerk and they don't want to know, but most doctors, given the opportunity to have enough people asking the questions, will go out and get the education to be, because again, we're all here because we want to be maximally helpful. So the beautiful thing about that book is it's written by an MD. You give it to your doctors. It's in the language of medicine, but it's also a really interesting read. I think it's totally accessible for the layperson. Do you agree?
Absolutely. I was actually reading on the airplane when we went out on our vacation last week. I was reading segments of this book to my husband, and he too was gobsmacked with some of the details that are being uncovered, particularly the Women's Health Initiative and why that went awry, and exactly what was some of the motivation behind allowing the reports that did more damage to women's health in centuries, probably alone, by stopping that initiative.
Absolutely.
And releasing those findings, and how they were released too was it didn't even get properly vetted through the chain of command.
It was $1 billion study. Like, it's crazy, by the NIH, the National Institutes for Health. Why it was not reported on better doesn't make any sense. I don't understand it, but here we are. At least we're on the other side of it now. But
We're on the other side.
I distinctly remember doing a women's lecture, health lecture in, oh gosh, I'm going to guess it was 2008, and saying to women, it's not safe to take hormones, don't take them. So science marches forward. Here we are.
Here we are. Yeah.
Here we are.
And this is a great segue for me to add that I am so pleased to be on the other side, and having landed on the menopause doula, not on the side of menopause, but on the other side of telling the true story,
got it.
real information.
I was going to ask you to fill me in. I was like, what happens? Tell me what happens when we stop bleeding.
Oh, no. Just when you think, hey, yay, and you get boarding on an airplane, you're like,
oh, hell.
God, that's a hot mess I am today. Where'd that one come from?
You have always got to be packing. As a perimenopausal woman, it doesn't matter how regular your periods were, you must always have protection. It's like when we were kids and learning how to have sex when we were in our early, teenage years or early 20s. We always had to have a condom. Remember, that was our generation.
Oh, yes. Always be
it's like that, but it's always got to be a tampon.
Oh, yeah. You must. At least to get through the first 24 hours, and then you go for the pharmacia in Mexico, and you look at the lady in the shop and say, yes, like I wasn't planning for this on my vacation. And they just laugh at you in pity. But to be on the other side in terms of supporting the healthcare system, and to be able to do it at a time today where the research is more readily available, we're having these conversations and we're breaking down that old narrative, having that paradigm shift. We're in this together collectively. I think we're just scratching the surface, though. There's still so much more work to be done. Grateful for you, Dr. Lovely, for the work that you are doing. And you have like millions of listeners worldwide now, and just the ripple effect that is going to have on women reaching out to their communities of women and their friends and mothers and sisters and cousins, et cetera, and let's just also clients who do not identify as women but still have the female hormones will still experience the menopause. So that is an entire audience that cannot be forgotten and needs to be supported as well. I am so enamored of the work that you are doing, and this inspires me to go deeper in my menopause doula when I do eventually hang up the corporate hat and open up my practice as a doula. To be there to hold space, I'll be reaching into the sage advice that you give, the resources that you're providing, and directing women towards you, and just even your podcast alone, just to get that reassurance and feel I'm being heard. I'm being heard, and I feel safe, and I'm not isolated. And boy, did I get a good chuckle out of that too. Because we have to be able to laugh, like you said earlier on. We must be able to laugh. I want to bring you back several more times. We have been almost an hour, and we've just, what I feel is barely scraped the surface, but we've unpacked some very important information. We'll get into some more juicy details like the vaginal estrogen for incontinence later on.
Oh, come on. That's like the best teaser ever. And yes, I would love to come back. Thank you.
Thank you.
I told you we would cover a lot of ground this episode, and we did, with so much more to discuss. And we live in a privileged time when we can have these conversations openly without the shame, the blame, or that mistreatment. Because, as Dr. Fiona often says, science marches on, and amen to that. So for my takeaways from this episode, I'd like to recap on the books that we talked about, which are all linked in the show notes. Books that have come out in, say, maybe the past dozen years or so. And that is because that is how fresh and how new the research really is on hormone health. So here they are. Number 1, Estrogen Matters by Doctors Avram Blooming and Carol Tavris. They both give compelling arguments in this book of the benefits of estrogen therapy for women, challenging the prevailing medical views and emphasizing the important role estrogen therapy can play in promoting overall health and well-being. Number 2, The Upgrade. Inspired by our own experiences treating many women who've come through her clinic, Dr. Luann Brizendine explains that the female brain gets stronger and better in midlife and the years beyond. setting women up perfectly to step into her power and live her life with purpose. Number 3, The End of Alzheimer's by Dr. Dale Bredesen. This book encompasses cutting-edge scientific findings into a practical strategy to showcase that we really are capable of not only reversing Alzheimer's, but also significantly enhancing brain health and function. And number 4, Lisa Mosconi's book, The Menopause Brain, which explores the impact of menopause on cognitive function and offers insights into maintaining and promoting brain health during this phase in our lives. So there you have it, a plethora of fantastic books to delve into in the new year and enhance your learning journey. Just filled with information that can revolutionize your experience of your menopause transition. And if you're eager to get more wisdom from Dr. Lovely, you can tune into her regular podcast, Not Your Mother's Menopause. And the last point, and one very deserving of mention, the subject of suicide was touched on very briefly in this episode, and it shouldn't go without attention. If you or someone you know is experiencing thoughts of suicide or self-harm, it is crucial to seek immediate help from a qualified mental health professional, a helpline, or emergency services. Always prioritize the well-being and safety of individuals by connecting them to appropriate professional assistance. Do you need support through your menopause transition? A menopause doula can help. You can find me at mlcoaching.com. And help me help you by filling out a simple survey, which is linked in the show notes. Your input is greatly valued and will help in the design and creation of tools, courses, and other resources for my upcoming one-on-one and group coaching programs. Take the survey, it's linked in the show notes. Like, follow, share, subscribe. And if you are enjoying this podcast, I would love to hear from you. Consider leaving a review. Spreading the word will help broaden my audience reach and further impact more women as they experience a transition.